Good afternoon, everyone. Welcome to our webinar hosted by the ACP Saudi Arabia Chapter Medical Students Council. I'm Shams Al-Bashir, Chair of the Medical Students Council, and I'll be your moderator for today's session. I'm thrilled to extend a warm welcome to our esteemed guest, Dr. Ahmed AlRashah, who's an internal medicine chief resident at King Saud Medical City. Dr. Ahmed brings a wealth of experience and insights into the residency program, and we're privileged to have him share his knowledge with us today. Dr. Ahmed, thank you so much for taking the time to join us today. We're very eager to hear from you and learn from your experiences at KSMC. Without further ado, let's get started. Would you
Assalamu
like?
alaikum. I hope am I audible?
Yes, you are, Doctor.
Good evening, everyone. Thank you so much. I would like to extend my thanks to the ACB Saudi chapter, to the people behind it. Before I say something or I go into the discussion, I have no disclosure, no conflict of interest. I really feel happy to share some of the fact about the internal medicine residency program in King Saud Medical City. The program was in such name till 4 years ago, where the program has to become the Cluster 1 internal medicine program, where we added multiple training center. Now our training center include the King Saud Medical City, which is the main campus, and King Salman Hospital as another training center, and to add program in the Saudi board for this year, and during this batch, the people from R1 to R4 are more than 100 residents. And this may just give you an example of how big and how well established this program is. The rotations that each internal medicine resident should have and should go through is all affiliated in our center, in our program. And I mean that if you talk about cardiology, we have a cardiology center that has also cardiology fellowship and multiple subspecialties of the cardiology itself. If you want to talk about ICU, then we have one of the biggest ICU in the Middle East, not only in King Saudi Arabia. And our residents are able to go and rotate there. Not to mention pulmonology, rheumatology, hematology, and the list go on and on. So just to make the long story short, each resident who is belonging to the King Saud Medical City or the Cluster 1 internal medicine program does not have to go outside the cluster to rotate and to finish their residency. However, we give an allowance of more than 25% of each year rotation to be outside the center, should the resident want to explore other options. This is more likely when people get to their senior level and they want to explore more of the opportunities, and whether they want to do such or subspecialty or that, then they would have themselves exposed to other centers to see how the real story behind that subspecialty is. If to talk about the trainers or the trainee, well, I would always be honored and happy that I had the privilege and I have the chance to work among them. Our trainers are well educated with a high level of experience, either in the field in Saudi Arabia, or those who come from the North American or from the European, being European certified physicians. With all that being said, we are really proud to have the internal medicine program in King Saud Medical City, or in the Cluster 1 as a whole. We know that the outcome of this program has yield to a fertile ground to the kingdom as a whole. You know, we have residents from across the kingdom, and after they finish their training, they go back to their original cities and they serve again the community. So what you planned in this program, you can see the seeds all over and across the kingdom. Some of our colleagues who graduated from this program is now already in the North American subspecialty programs, and they are yet being waited to come back and also contribute to continue the outstanding measures that this residency program carry out. I really don't know where the people who are attending with us coming from, and I don't know which universities, but we have so many colleges and universities who send their students to rotate and to train in our center. We were in a really close touch with them, and we were happy to have them, and we see in them the future that this program also depend on. I remember when I first came, I graduated from Poland, and when I first came to Saudi Arabia, I was asking where is the most exposure that I may face to see cases, and I would say that almost everyone who I asked said to go to how the name goes by, Shmensi or King Saud Medical City. So I remember where people were talking about, wow, in an external center, we have to see a lupus nephritis in a patient with SLE with all the manifestation. My colleagues in the King Saud Medical City were discussing what is the duration of the treatment of bone marrow TB. We came across the alpha-1 antitrypsin deficiency, and we saw all the manifestation up to the liver cirrhosis and how the patient was candidate for liver transplantation. I remember that we have seen the inclusion polymyositis, and it was mistakenly diagnosed somewhere else as a term of myopathy or as a term of stroke of unknown etiology. So with the real fact that this hospital has an open door for all people, we get to see cases. The access to our hospital is quite open, yet we really sometimes during the long night on calls, we feel so bad that it's tiring, it's getting exhausting, and we become severely dehydrated because we don't even have the time to sip the water. However, on the other hand, the more you see, the more you know. Whenever you will see a patient with that certain findings, it is just stuck in your mind and it's forever there. Gilbert syndrome has been one of the diagnoses of exclusion in so many places in the textbook. Believe me, if you will came across a patient who is young and coming with a benign jaundice in King Saud Medical City or in Cluster 1, our colleagues would have put Gilbert syndrome from the differential, not because it is easy to diagnose as it's a diagnosis of exclusion, but because we have seen enough and we know what kind of patient that they would exhibit the finding and the picture of a Gilbert syndrome. So I'm bringing all those examples just to show how diverse the cases are in King Saud Medical City or in Cluster 1, just to show you that what you would expect to see in the field, just to tell you that medicine is not just reading that this is hyaline gap metabolic acidosis and the differential is that and this and this. It is just what you see, what you practice, and how you engaged your own experience in the readings to the real life of a patient. King Saud Medical City and Cluster 1 again, as a whole, will give you the opportunity to deal with real life scenarios and give you the privilege to take a decision. Yes, you are always supported, you are always supervised, and you will always find someone who will help you. Yet you will feel so confident that you can take a decision. You will make a change, and you will prescribe a Denixa in the middle of the night to counterattack the apixaban bleeding. Yes, the drug is 10,000 US dollar almost, if not more. However, you will be able to prescribe it, to give it, and to see how beautifully it works. This is how diverse. This is how the real life is going on in cluster one. Uh, just before I conclude about this point or about this section and leave you the floor if you have a particular question, one of the things that I'm really happy to say, and I always take pride for, and I always share it with everybody, and I make people to come and see themselves, is how the environment is being conducted, and what is the relationship between the seniors and the juniors, between the trainers and the trainees, and between us as program resident with our directorship. The friendly environment is the cornerstone of having the internal medicine in King Saud Medical City or in the cluster one as a whole. Each time as you go to your workplace, is this the time where you will see your friends? Is the time where you will talk to your senior colleagues? Is the time where you will chat with the consultants? And by the end of the day, yes, outside the round, outside the context of a patient's care, everybody is just by their name. Yes, we respect our seniors. We take care of our juniors. But the cornerstone or the hallmark of King Saud Medical City program is how friendly the environment is. I hope that so many of the students who rotated with us could just give you a hint about what I'm saying or about what I'm talking about. I'm leaving the floor for you guys right now. If you have any question, if you have something that I didn't cover or you want to emphasize on something.
Thank you so much, Dr. Ahmed, for this brief view on KSMC's residency in internal medicine. We had a couple of questions to ask you, if you don't mind.
Absolutely.
First question would be: is how has your experience been as a resident in King Saud Medical City, and how did it make you grow as a person?
Well, my first contact with King Saud Medical City was in 2020, just directly after I finished my medical school in Poland. And I would tell you that the person who entered the King Saud at the time is not the same person who is talking to you right now. In King Saud Medical City, I wanna now, because the talk is about King Saud Medical City, I will be concentrating with the campus. So the thing is, the person who entered that day in 2020 is not the same person who's just now talking to you guys. Yes, you will find it difficult at the beginning. It's a big campus. It's a big medical city. However, when you be working among the strong people, you get strong. And I like to say this example. And in Europe, they do football, they score goals, and they have championships. In Saudi Arabia, we have so. In the US, they do so. And in other countries, they also have their leagues, and they have their football games. Yet playing with Real Madrid, Barcelona, or with Manchester City is not the same as playing with X, Y, and Z. So that's why when you play among the strong people, you become stronger. I came, and my experience in Saudi Arabia has been nil about how the medical school, how the internship, what are the golden months, and etc. 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 Yet, when I went to King Saud Medical City, my real intention was I want to get the better exposure, okay, and to see how the heavy load and how the hectic work would impact on me as a physician. Am I in the right track? Yes, it was too late to ask that question 6 years after medical school. However, you want to know whether you go to that specialty or this subspecialty. And what I find is what doesn't kill you make you stronger, and that in terms of the hour of working or the amount of patient you have seen. That would affect you in a term of the more you see and the more you know. As a person, I came and I told you I was hesitant. I was really fearing the future. It wasn't unleashed for me, and I don't know what's behind that. And today, I would say that they they have us with a warm opening hands, and they were up to our expectation. They were helping whenever we needed them. I had to call even once a consultant after 3 a.m., 4 a.m. just to discuss the case with him, and he wasn't that guy who was feeling not well to have him called at the middle of the night. So I know by working King Saud Medical City is yes, being a doctor does make a change. You are in a close contact with all type of personality, with all type of nationalities. You are in the same level of contact with the patient as they are the Saudis or the non-Saudis. By working King Saud Medical City, I know that the most precious thing is health, and what we've seen and what we went through really told us this fact. I started 2020 in King Saud Medical City, and if the time would go back 10 times, I would do the same start.
Thank you so much, Doctor, for your answer. If we delve into the details of the residency program at King Saud Medical City, how would you describe the typical rotation schedule within a week?
Within a week?
Yeah, like on Sundays, Mondays, Tuesdays, Wednesdays, and
Okay,
Thursdays. What do you usually do?
Okay, let me break our schedule down for you. In terms of if you are not rotating with rheumatology, pulmonology, hematology, nephro, gastroenterology, you are just mainly with internal medicine. This is how you expect to have your week. You will be allocated to be either in a CTU, which is a clinical teaching unit, and we have 5 clinical teaching units, A to E, and or you will be in a night floater. The working hour is from 8 a.m. till 3:30. Each CTUs will have 2 to 3 consultants, 4 specialists, and 3 to 4, sometimes to 5 residents. Each CTUs usually consist of 15 to 20. Sometimes in hectic times we reach up to 40 patients per CTU. However, this is just the unusual. The usual is 15 to 20, and each resident will be assigned to a good number of patients. The usual is 4 to 6 patients. Might get more than that, might be less than that. Then each resident will be responsible about his patient A to Z. Yes, they will not take the decision without referring to their specialist. If the specialist does not know how to answer their questions, then they will refer back to the consultant. Usually they round with the consultant. They see the patients on a daily basis with their consultants, and they discuss the cases with the consultants. Each resident will be obligated to present each case for his consultant at each time that they see the patient, especially for the first time. So when the team is post-admission, then they will go and read about the case. If they are the admitting case, the one who admitted the case, they will be having a better chance to present the case better for their consultants. However, if they are not the ones, then they will be just going throughout the medical records, and then they will go and ask the patient themselves. So they will present the case, then the consultant will be asking questions. What do you think of that? What do you think of this? What is your differential? What is your impression? What we are going to do next? So this is in terms of working with the CTUs. So from Sunday to Thursday, you will be working that way. Each resident will have to be assigned for 1 weekend round. And what does that mean? That he will come and rotate and see the patient in the weekend round with a specialist. They will see together the entire patients of the team. And during the weekend, nothing much to be done. Just make sure that every patient is stable, if their plans is being carried out, if there is a missing medication to be entered, or so on or so on. That's in terms of the CTU, or working with the CTU, the clinical teaching unit. For the night floaters, they are the people who will be covering the internal medicine patient and their subspecialty during the night. And that is from the 10 p.m. till the 8 a.m. in the morning. So that's a 10 hours duty. They will be on for 7 days, then they will be off for 7 days, then will come back for 7 days. So they will be working a total 14 days out of 28 be the block. So this is, and they will be working in the night. So from 10 p.m. till 8 a.m. in the morning. So about the gaps in between the 3:30 until the 10 p.m., this is where we have our on calls. So the resident will be covering their own calls in that particular time. So it's from 3:30 till 10 p.m. That's 6 and 30 minutes on call time. And then that having this just 6 hours on calls that allow us not to have pre-calls or post-calls. So this is how the week goes on. And I know that some question will be, what's the average number of the on-calls according to the Saudi Commission for Health Subspecialties? We are following that, not less than 4 on-calls with a weekend and not more than 7 on-calls.
Thank you for that insight, Doctor. Could you kindly elaborate on what makes King Saud's Medical Cities residency program special, or what stood out for you when you chose your internal medicine residency program?
Yeah, as I said in my intro, that in King Saud Medical City you have an open access. I mean, in terms of patients, and as I told you that the more you see, the more you know. What makes it so special is the exposure. I know that in some programs, people talks, and we have friends from there and there, and sometimes they would have a 1 month uh, rotation without even seeing one vaso-occlusive crisis of a sickle cell disease patient. So common is common. So the common diseases that you will be the master of them by just working in King Saud Medical City, because you see them on a daily basis. You will have a very clear insight about how the patient is being presented. You will be having a very clear way of thinking about your patient. You can easily rule out the red flags or the emergencies for each patient coming from that particular group of patients, and you can really have a good plan for them. And the length of stay for our patients, especially those who are presented with a very common scenarios. I'm talking about the community-acquired pneumonia. I'm talking about the sickle cell disease and its manifestation. I'm talking about the DKA patient with their different causes of their DKA. As a resident of King Saud Medical City, you will always have a very clear insight, and you will have very clear plan of care for your patient, not only because you know how to care about them, but because you have seen them in a daily basis, and that give you just the hint of it, and you know how to deal with them. Unlike in others, where you will see that, yeah, really the most sophisticated cases, the terminal cases of patient with, I don't know, leukemias of hairy cell type, or you will see patient with XYZ of advanced hematology, oncology causes. But the real life story of seeing patient daily basis will be missing for that particular people. So that's why. So the exposure is one. This is very, very important for me. And as I told you, if the time will go back 10 times, I will do the same. Exposure, exposure, exposure in King Saud Medical City. You will be exposed to things that you thought it does not exist, and it's only in the book. You can ask around you guys at any hospital other than King Saud Medical City, how many cases of TB have you seen, guys? And they will tell you, all the TB, I don't think that we have TB. And yet we have sometimes whole blocks or whole wards being blocked only for TB patients. You will be dealing with the non-Saudi nationalities and with their comorbids, and they are coming with their own endemic or epidemic causes of diseases, and you will be able to deal with them. I'm talking about, for example, malaria. Malaria is not a hell of a work for us. We really know how to deal with it, not because we really like ID or because we like infectious diseases or because we like, maybe we do so, or on the other hand, because how many we have seen, how many we are dealing with, the more that we know, the more we know how to do it. One important thing other than the exposure is the environment. I have been rotating in different hospitals, very prestigious, very respectful. I gain a lot of knowledge just rotating with them. However, you still feel that there is something in the air. You don't feel that you feel just you can approach the consultants or the specialists or those who are senior to you the same way that we have it with our consultants, with our specialists, with our seniors. So the friendly environment, as I said, and it's always something that I'm proud of and I take pride for, that the friendly environment that King Saud Medical City possesses. And with all of that being said, you can just wrap it with a fine note. We don't miss anything. We are affiliated. Our program is affiliated in each and every subspecialty for internal medicine residency program. I know people who graduated from King Saud Medical City and they never rotate outside King Saud Medical City. They started the program R1, they finished R4, they went to their subspecialties outside King Saud Medical City, and they never had an outside rotation there, King Saud Medical City. So that's what make it stand out for me. And if only the exposure was the only thing, I think it's more than enough.
Thank you, Dr. Ahmed. Since you brought up a fellowship and subspecialization after residency programs, do KSMC residents that graduated from the internal medicine residency program get any advantage at applying to the subspecialty after their internal medicine residency at KSMC? Do they get any form of support?
It's not only by that, not because you are just the, let's say, the son of that program, but because people know you. You have been rotating with them since you were an R1. Let's say, for example, in nephrology now, because the whole F1 right now is from King Saud Medical City. They have been working with them for the last 4 years. Yes, I know nephrology rotation might be only 2 rotations or 4 maximum, but we were in contact with each other by consultation. Nephrology will consult medical will consult nephrology, and people are interchangeably acting with each other. So they know you, they know how you think, they know how you approach, and they know what kind of person you are. So during those 4 years, we have really known this particular person. That's why when X is coming from outside the program and Y is coming from the program, and I know this Y is way better, or let's say the one who's coming outside the program have, let's say, a better CV. He did 10x research on nephrology topics, and he did this and this and that, but they don't know what kind of person he is. But they know the guy who was working with them for the last 4 years. So yes, they have advantages. And we as resident of internal medicine program in King Saud Medical City, yes, we have a privilege. We are really having the advantages of getting accepted in various fellowship specialization in King Saud Medical City. And if you want to count how many fellowship we have, I will tell you that we have in King Saud Medical City more than 73 affiliated programs. Yes, 73, you heard it correctly. Because we have also a sub specialties in even nursing and in administrative specialties. So yeah, it is well established cluster, and it has a variety of sub-specialization. It has a variety of affiliated fellowships programs. And yes, as internal medicine residency program of King Saud Medical City, you will have privilege to get accepted in our programs in King Saud Medical City.
Thank you, Dr. Ahmed. If we speak about the residents' well-being and their work-life balance, how does the program ensure that they do feel well during their work days, and how do they ensure that they maintain their work-life balance?
Let's just agree that those questions weren't sent to me beforehand, right? So I don't know any of them. But however, I like the terms that you are using here: the wellness and the work-life balance. so many times I was saying during the intro and during the talk for the previous sometimes the environment, the friendly environment that we have, and how we are dealing with each other. And let's say someone would have some hectic time. Okay, for example, last year some of our R1s did not, no, the year before, some of the R1s did not unfortunately pass the part 1 exam. So they are still able to go to the R2. And at the time where the exam was about about when they were about to set their exam for the second time, the encounter by the program itself for those people who are sitting the exam for the next time, and the program wants really to have them succeeded. Yes, we took that into our consideration. We approached them. We told them how we can help you. Do you know how to study for it? This is the sources that you have to go through, and this is the way of reading it. And on top of that, from this time to this time, you are free from all of your duties with us. So this is how, for example, how we try to ensure wellness, and the residents who have patience in the program will go through their programs. And to talk about work and life balance, I'm saying that our duty time, working hours, is from 8 a.m. till 3:30, whereas on the contrary, in other centers, it is from 8 in the morning till 5 p.m. So those 2 extra hours is in our favor. I'm saying that each resident will have 4 to 6 on calls, and it's almost always 4 plus 1 weekend round, whereas in others they will have always the maximum number of the on calls. So the thing of working and having the life balance is for me more of a personal dealing with the real life. If I'm a person who likes to sleep from 2, and then I will find it very difficult to go to work, then I'm not the person who would just have to think about work or life balance. If a person is well organized, I don't think the working hours or the workload of King Saud Medical City is a matter for them. Believe me, we finish our duty at 3:30. We'd be staying till even after Maghrib, just chatting and talking, and this is how the environment is. If some of the colleagues that does not feel good to continue the in-call on his own, we would be staying with him till 10 p.m., till the night floater would come. This is what I'm talking about when I say the friendly environment that the King Saud Medical City accounting for.
Thank you so much, Dr. Ahmed, for your answer. For my next question, what unique educational resources does the program offer in terms of like simulation labs or access to research facilities?
In terms of simulation labs, we possess one, but this is more for the surgical subspecialty. I don't see what could a medical need a simulation labs for. And in terms of the research facilities, yes, we have very good research center who are actively participating with us. They even have a morning reports with us. They have a half-day activities with us to share their knowledge, to tell us how to do the critical appraisal for papers, how to start researches from the scratches, and how to do the statistical analysis. And if you want to be funded from them, they would fund you. And yes, we have a very well-established research center who is almost always happy to help, especially when the topic or the subject being investigated is interesting. And they would help you even reaching to your publication.
Thank you, Dr. Ahmed. As the resident progresses through their this residency program, could you describe the level of autonomy and responsibility that they have?
You know that an internal medicine program encompasses of 4 years. You have the R1, R2 levels, which is the junior levels, and we have the R3, R4 levels, which is the senior levels. Yes, we have a duty description that is different for both levels. It's almost the same for the juniors. It's almost the same for the seniors. I mean the duty description. Um, the resident will see and themselves how they actually grow. Yes, we have duties that we don't expect it from the junior levels, whereas we expect it from the senior levels. And there are some tasks that we would expect it from the junior levels, and we'd expect the seniors to help them doing it. Yes, they progress and they become more responsible. We rely on them and much deal as they go with the program. And even sometimes there are some residents who stand out really early on. We have now resident at the level of the R2, whom we really count on them as if they were senior. So you can see that it is we don't work as robots. We really humanize our dealing with each and every resident of us, and we take everyone in their small details. We use their knowledge, their experience to help us helping everyone. So yes, you could see that they process, they grow, and we work as a unity.
So, as the residents progress and grow, how are they provided with feedback?
The feedback is by the end of each rotation. Each resident will get a biofeedback where they will be evaluated by multiple consultants of their rotating area, either in medical or in its subspecialties. Okay, they will have mid uh, mid rotation feedback from their trainers. They will tell them where there are strong and where they are need to be improved. And by the end of each rotation, they receive throughout the 145, which is a platform where residents are evaluated, and where they can give feedback upon their consultants or their trainers. So yes, this is how they are evaluated. And as I said, yeah, during the rotations, if there is something should be raised during the rotation, they would be sitting with their respected trainers, and they will have to talk about it. Also, each resident is assigned to a mentor who will be throughout the years with them. They set meetings on a regular basis, and that is Q quarterly. So in each 3 months, they will sit together. They will discuss their plans, what are they are going to do, how they did with their previous plans, and that's how they are being given the feedback.
And once they graduate, what do most residents typically do after completing the program? Do they mostly stay in academia, pursue fellowships, or do they enter private practice?
That's more of a private question for each resident. If you would ask me, I want to go for fellowship. If you would ask my colleagues, you want to go and do some researches, become a college member, or and for the private sector, I don't think that people graduate just to go for a private sector. Yes, because they are good, the private sector will ask for them. Because they have names, yes, they will. The private sector will ask for them because they are good at what they are doing. They are going to be asked about to come about by the private sector. But this is more of individualized pattern for each resident, how they would pursue their future. But mostly people will go into fellowship. They will see what they like, and they will see what the market demands. So, and they will weigh benefit and risk between choosing between subspecialties. Some of them are being sponsored by pre-free hospitals, and they have set a contract with them to, for example, you have if you have interest in XYZ subspecialties, we want you to go into it, so your seat is already ready to have it, and once you have it done. So this is more of individualized question, I believe.
Thank you, Dr. Ahmed. My last question from this is the program facing any challenges currently? And if it is, how is it addressing them?
Because I couldn't hear. What challenges does the program currently face and how it's addressing them? So one of the challenges that we were having, it's not actually the program, but the entire cluster where we used to have the paper EMR, or the medical record for patient. And thankfully, since I believe more than 6 months, we have started our EMR system. Wafiq, if any one of you worked with us, you know what I'm talking about. And that was one of the challenges. The other challenges that I may think of is in some training centers, we were having some difficulties arranging and doing the half-day activities and the sessions. However, to solve our problem is just to address there is one, and that was the last year. Challenges in its real meaning, I don't think we do have challenges. Yes, we are eager to improve what we have. We know what we were 4 years ago, and we know where we are right now. And if it wasn't for the mentality of the program directorship that we always look for better outcomes, we would have been staying at what we were. But because the mentality is always what is next, what could be better, what can we improve in this or that, we are always changing. One of the things that just crossed my mind right now, last year we have started so-called social club. And the social club is something non-curricular. It is an extracurricular activities. We have or the social club committee, thankfully, and started to gather people outside the context of medicine. We had one times we had a paddle tournament that was held last Ramadan. For the guys, we had also a movie night where we had to book the entire cinema theater for our colleagues from the female side. It's been helping easing some of the pressure of the medicine. So that wasn't for us a challenge at the time, and just to ask the people to gather outside the context of medicine, but it was something that we saw that we could improve our program by having this. And we did it in the internal medicine residency program, orthopedic program, general surgery program, ophthalmology program, heard about it. They started this and they started that, and now people interchangeably carrying their thoughts together, and not necessarily to have a challenge to improve, but to improve is just to have a mindset. So it is a set of mindset to improve, not only to face a challenge to have it solved.
Thank you, Dr. Ahmed. We've received some great questions from our audience. If your time allows, could I read you some of those questions?
Yes, absolutely.
Thank you, Doctor. The first question is, what qualifications would set apart a candidate that's applying to your program?
What qualifications does what?
What qualifications would set apart a candidate that's applying to your internal medicine program?
To our residency program? You know, it is a cycle. It is a matching process. It's not only what we look for. It is actually a matching system by the Saudi Commission, and then the list will be, let's say, more than 500 candidates are applying for internal medicine and Riyadh. We would be looking into the all candidate. Yes, some will be unfortunately eliminated from the list due to this. This is a huge number. We will be interviewing them. What would make us accept a resident or a candidate in our residency program? It is highly, first, we will look into his CV. A good CV means it has been long nights, long studies, good communication skills, and good outcomes during their studies. And after that, it's the interview. And during the interview, that, believe me, you will get the sense where a person is interested in having your program or not. And most importantly, we have internship program in our hospital. It would be very important to know whether the student or the intern has been rotating with us, and if he did not rotate with us, to know whether he did try or he applied, or what was the reason that he didn't rotate with us. All of that with a good interview and with a good CV, okay, and that being craft by very good interest in internal medicine, and a person who really comes for internal medicine for the love of internal medicine, because the real definition of internal medicine is just the real patient, seeing them in real life and dealing with them in a good quantity. That's the good candidate for me. Those people who know the chain of commands, those people who knows how to respond well to any emergency, who will always be a safe physician, who will always be asking whenever they don't know. Those are the applicants that I'm looking for.
Would a person or a candidate with a low GPA get a chance in this IM residency program?
GPA is just a number. GPA does not necessarily reflect that the one who came for you for the residency program was not doing their best in the school. It would help, yes, but does it ruled out anyone from the interview? No. We don't interview the GPA. We don't interview the CV. We interview the person. Okay, a person with a good communication skill, a person with a good personality, a person who knew that he want to correct that low GPA in the school to have a good practice in the real life, is actually one of those you would really feel happy to have them in your program. So GPA is just a number, does reflect, yes, to some extent, that how you were working during your school, but does not necessarily mean that you are a bad person or a person who wasn't giving it its maximum during the school.
Dr. Ahmed, you've mentioned communication skills and a good personality. Are there any
Yes.
specific personal skills you need or you look for in a person or a candidate?
We are different. So everybody has their own personality, their own communication skills. I don't expect to have everybody the same, but common is common. One who is able to be working with office, have a good English. He knows how to address their seniors and you know how to follow the chain of commands. Is a common sense. Someone who is good at public speaking is an extra. Someone who have participated in their school as the leadership roles, yes, they also get an extra credit. But diversity is a thing, and this is something that you would expect it on daily basis. So I don't expect to see all the same, but common is common. And just to be different in each interview. And this is my message for everybody who's hearing us or who will be hearing us later on. Okay, be you, just to be different. You just need to be you, because you is a different DNA, different thumbprint, will make you just special. Don't try to mimic someone, don't try to copy someone, but common is common. Respect the senior, following chain of commands, being a safe physician.
Doctor, you've mentioned people who have a fast reflex, or people who can respond to emergencies, those that are respectful, those that have good communication skills. Do you have any other tips that a student could use to stand out during their internal medicine rotation?
The best thing that and during the past 4 years for internal medicine that I saw in learning medicine is read what you have seen. So during your rotation, you will be seeing a patient with X diagnosis. You will see the patient, you will go throughout the patient, you will ask the patient a question, and then you will go home and read about the topic and see how does the topic match with your patient. And if there are some aspects that you didn't ask about or you don't know whether it matches or not, then this is what you will do the next day. You will go, you will ask, and you will see how it will match your patient. And by doing this, you will always ace it. And the good thing, and this is the hint that will not be mentioned in the books, is what could be the differential. Let's say your patient is already having established diagnosis or working diagnosis. Okay, what could be the differential? Because sometimes you might be the only one who would be thinking of that, and you are going to be the only one who will redirect the management and the investigation for that patient. So see the patient, know what is the working diagnosis, go read about the working diagnosis, what could be the differential for that working diagnosis, and then you can just easily feel happy with medicine. Medicine is all about, if it doesn't make sense, don't memorize it. It's always making sense. This is the beauty of medicine. Medicine is always a solid ground. Medicine is always that you will have always a clue about everything. Yes, you might not be as deep as the hematologist in coding and sequencing the whatever leukemia patient have, but at least you can call it acute AML in the middle of the night, and you will start the ATRA because you are an internist. You can always see that patient is coming with an acute chest syndrome because you have a vaso-occlusive crisis, and you will contact the hematologist in the middle of the night to have the patient saved by plasmapheresis or exchange or IVIG or whatever the treatment will be decided on. So as an internist, you will have you will have a clue about everything. You will manage most of the thing, and you will know when to call it emergency and when to ask for expert opinion.
Doctor, how would a candidate know if they did enough to compete in applying to internal medicine residency programs?
You mean before or after the interviews?
Before the interviews.
If you are nominated for the internal medicine program, let's say you are nominated in Riyadh or nominated in XYZ cities, you've done enough. Unless that city or that area of the globe is not what you are interested in. You want Riyadh, for example, or those from Jeddah wants in Jeddah, or those from Najran wants in Najran. But this is you've done enough. If you are nominated, if you enter the match, you have done enough. Okay, but what is after, this just depends on you, how you will do during your interviews, how you will convince people, how would you sell yourself for each center you will apply for.
You've mentioned one of the best things about KSMC is the high variation in terms of diseases that you get exposed
Yes.
to, and the
Yes.
high number of fellowships that you offer
Yes.
in KSMC.
Yeah.
What would set apart KSMC as a residency program from others? What would help a medical student choose KSMC and not other programs, in your opinion?
Yeah, you just mentioned it. You said it. The exposure, the variety of cases. This is one. The good environment. For example, last year in the list of what are the best hospitals in Saudi Arabia, it was the King Saud Medical City was fourth, I think, or third. This year we came second. I don't know 10 years ago where we were. In King Saud Medical City, the curve for us is just going up. I think you can see the smile behind the talk right now, because how I'm seeing King Saud Medical City evolving and moving forward is something really making everybody coming from that place happy and proud to be part of it. just to emphasize on the fact, the variety of cases, the good exposure, the friendly environment. Put all of that together in one basket, then you are talking about internal medicine program in case of medicine.
Doctor, the last question is, what are some misconceptions that you know and that you've realized are not true about internal medicine?
About internal medicine. Internal medicine is a residency that people will go in to have it to know 100% they will get a program. Internal medicine is difficult. Internal medicine will always make you get involved in patients more than others, and internal medicine is the weakest circle in the big jungle. Whereas internal medicine last year, the cumulative grade to enter has really increased more than 15 to 20%. Yes, you have to see more patient. I agree with that. However, not in terms of because you are internal medicine, but because you are the expert and you know how to deal better with the cases. Internist is not the weakest, but the strongest. You are the internist, you are the smartest. This is how I like to think about it.
Thank you so much, Doctor. As we come to the end of our webinar, I wanted to extend a heartfelt thank you to Dr. Ahmed Saleh. Would you like to say a few words?
Thank you so much, guys. And for those who are listening, or for those who are to listen, before you step your first step in each and whatever residency program you will go to, imagine yourself after finishing the program. Is that the kind of person, the kind of father, the kind of consultant you will be? Or don't ever start it? And if you started something, you find out the middle of the way that it is not you, it's not what you want to do. Believe me that getting out of the train at the nearest station would make the ticket for the ticket back cheaper. It's never too late for a physician, and always have faith that you are destined and your destiny is the best. Thank you so much. I would like to thank Shams, Yazan, and everybody who gave me the opportunity to be meeting with all of you guys. And I wish you all the best. Let's see you around King Saud Medical City and say hi and bye. Thank you.
Thank you, Doctor, for sharing your expertise and insights with us today. Your firsthand experiences have provided us with invaluable guidance to our audience. To our attendees, thank you so much for joining us. We hope you found today's discussion informative and enlightening. Remember, the journey to become a successful medical professional is filled with opportunities for growth and learning. Stay tuned for future events and webinars hosted by the ACP Saudi Arabia chapter. Until next time, take care and continue striving for excellence in your medical careers. Thank you, everyone, and goodbye.